What's going on, everyone? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, we'll be looking at rehab exercises for a condition called athletic pubalgia. This used to be called a sports hernia. We've seen that this has changed in the research. It's not really a hernia. It's basically an injury of your core muscles, your deep abdominal layers. So if you have pain on one side of your abdominal area, in your groin area, and maybe you're an athlete that's involved in kicking and running, sprinting, then stay tuned for today's exercises. So again, athletic pubalgia used to be called a sports or sportsman hernia. Again, this is different from a hernia. A hernia involves the abdominal contents pushing through a weakening in the abdominal wall. So athletic pubalgia is not a true hernia. It's a weakening or tearing of the abdominal wall. So it's often referred to as a core muscle injury. People who have this will have pain on their pubic tubercle, which is a piece of bone down near kind of the groin area. So it's usually just on one side. The pubic tubercle is this bony area that sticks out. Our abdominal muscles come down and attach down here. So it's a weakening or tearing of that abdominal area. It often also involves the groin muscles. So people might have tendinopathy or tendinitis of their groin muscles. Again, this type of pain is usually just on one side and typically involves situations where the person's sprinting, cutting, pivoting, kicking, sports like that. It also can occur in non-athletes. So the pain will be on one side. It typically happens when the person tries to do a sit-up, maybe if they're trying to use their hip flexors or their groin muscles. If they're coughing and sneezing, that can cause pain, and the pain will get better when they rest. So if that sounds like something you have going on, then stay tuned for the exercises. The exercises in this video are going to progress from less challenging to more challenging on the abdominal tissue. So if anything creates pain, just hold off on it and retest again in a few weeks. Most people with athletic pubalgia will get significantly better in 6 to 8 weeks. So because this is a core muscle injury, we really want to work on rebuilding capacity and strength in the core muscles and in the muscles that support the core, the hip flexors and the groin muscles or adductor muscles. Like I said, a lot of people have pain doing sit-ups, so as you get better and this condition gets all the way better towards the end of rehab, you should be able to do sit-ups again without pain. You should be able to run, sprint, all those activities. So this first exercise is called a transverse abdominis isometric. It is a contraction of one of our abdominal muscles called the transverse abdominis. It's going to help protect this area and rebuild strength. So you're going to lie on your back. This is a really small muscle and contraction, and what you're going to do is, I'll roll up my shirt here so you can see, the transverse abdominis runs horizontally across the abdominal wall between these two bones, the ASIS bones here that you can feel on the front of your pelvis. So it's running right through here. What you're going to do is find those bones and then put your fingers just inside, and your goal is to tighten right there. So you can see I'm going to tighten my abdominal wall. It's a very small contraction. I'm not squeezing all of my abs. I'm not bearing down and squeezing my whole abdominal wall. I'm just working on bracing and squeezing with that transverse abdominis muscle. This muscle also will squeeze with our pelvic floor. So one thing you can think about is, imagine you are peeing and you stopped the stream of urine while you're peeing. That can be a way to also activate the pelvic floor at the same time. So you're thinking about just squeezing that abdominal wall, that transverse abdominis, and holding for 10 to 20 seconds and then relaxing. Relax for a few seconds and then squeeze again. You should feel tightness, kind of a poofing up of that muscle underneath your fingers right here. Find the bone, just go off of that, see if you can tighten. You should also be able to breathe. So if you notice that doing this, you have to hold your breath, then that's not what you want to have happen. You want to be able to just coordinate and tighten this muscle and still be able to breathe and talk. We start people here lying down on their back like this, in this hook lying position. As you get better with this, you can do it in sitting and standing. But it does take a little while to become coordinated with this transverse abdominis muscle. So just be patient with it, keep trying. It's just really working on that mind-muscle connection. But if we learn to tighten this muscle, it will help to strengthen and protect the abdominal wall and to reduce the chances that you have an injury like this again in the future. The second exercise will be a posterior pelvic tilt with a bridge. This is again going to engage our abdominal walls in a gentle way and then add in hip strengthening with the bridge. So for this exercise, you're going to lie on your back, and to create a posterior pelvic tilt, you're going to think about gently squeezing your abs to roll your pelvis backwards, kind of tucking your tail under. This will take away the curve in your low back, and then from there, you're going to lift and do a bridge. Okay, hold for a few seconds at the top, and then set back down, kind of reset, and then again, posterior pelvic tilt, and then bridge. Hold at the top for a few seconds. You're going to perform 10 to 15 repetitions like this, breaking it down into 2 steps, posterior pelvic tilt, and then bridge. And again, this will help to strengthen our abdominal muscles, that area that's injured, and then also our hip extensors, our glutes when we do the bridge. Okay, so again for this one, shoot for 3 sets, 10 to 15 reps, performing both steps, and that is our second exercise. Before I get into the next exercise, just want to mention my book is available on Amazon and Barnes & Noble. It has rehab programs for the most common injuries and pain issues. Each body region has its own chapter. Today we're talking about athletic pubalgia. I don't have a specific program for this issue, but in the hip chapter, you'll find a hip flexor program and a groin strain program. A lot of the exercises in those programs can be helpful for athletic pubalgia. Here's the hip flexor pain program. Each program is going to take you through 3 phases and have pictures of me doing the exercises. There's just going to be a ton more options than you'd get from one of my YouTube videos. These are just more comprehensive programs, like if you came to see me in the clinic for traditional physical therapy. So a lot of the exercises, again, here in the hip flexor program or the groin strain program can help if you have athletic pubalgia, this core muscle injury. I'll put a link for the book down in the description if you want to check it out. The next exercise will be a supine hip flexor march. So we're going to work on strengthening our hip flexors. This will also be strengthening our abdominal muscle at the same time. So you need a loop band like this. I'll put a link down in the description if you want to get a set of these loop bands. We're going to do this on both legs, but I'll show my right leg first here. You're going to put the band around both feet, put your legs out straight on the ground. I'm going to keep my left leg down and out straight, and then my right leg is going to pull up. This is going to activate and strengthen my hip flexors. I'm also going to think about tightening my abs a little bit, kind of bracing with that transverse abdominis again, which will work on just maintaining kind of core stability and again strengthening those abdominal muscles that have been weakened or torn a little bit. So we're just working on building strength and capacity there again. Our hip flexors attach right near where the core muscles attach. So your hip flexors are sort of a synergistic muscle group and help support your abdominal muscles. So go for 10 to 15 repetitions like this. When you've finished on one leg, set it down and then perform on the other leg. Again, think about kind of bracing and keeping just a small contraction in your abs. It's not a really strong, forceful contraction, maybe a 2 or 3 out of 10. Just kind of holding there. And again, with each leg, go for 3 sets of 10 to 15 repetitions. For the last exercise here, we're going to strengthen our groin muscles or hip adductor muscles. Like the hip flexors, our adductor muscles help to support the abdominal muscles. And actually, a lot of people who have this athletic pubalgia also have a tendinopathy or tendonitis of their adductor muscles. So we want to start strengthening those muscles and tendons as well. This first exercise for the adductors, I'm going to lie on the side that I have pain on. So if I have pain on the right side of my groin, I'm going to lay on my right side. So what I'm going to do here is just lie down. I'm going to take the leg that I'm not working and place it kind of in front of the leg I am working. And then from here, I'm just lifting up and down using those adductor muscles to lift my leg into hip adduction. This will strengthen the adductor muscles, which are kind of in the middle part of the thigh, but also there are tendon that attaches way up in my groin area on my pubic bone. So like we did in the other exercises, think about just a little bit of a transverse abdominis contraction here. You can put your hand around front by that ASIS bone, feel the transverse abdominis squeeze, and then lift the leg, again going for 3 sets of 10 to 15 repetitions. Okay, so that's our last exercise in this video, an adductor raise. There's a lot of other exercises that you could potentially add. This is where the programs in my book can be helpful. But over time, you want to work towards planks, side planks, front planks, and even getting back to sit-ups. But just take it slowly. If something causes more than mild pain, then just hold off on it. Retest it in a week or 2. If you have any questions, put them down in the comment section. I'll see you guys in the next video. Bye.